What is that, 402?
But it is my
403?
back in time.
I'd like to call to order this Personnel and Human Services Committee meeting for Tuesday, October 20th at 4:03 p.m. Dan, will you take roll, please?
What?
Here.
Kelly?
Here.
Rancid?
Here.
Pickett?
Here.
Kuna?
Here.
Harris?
Here.
Krieger?
Yes.
Wonderful.
Okay. We had before us the minutes of 9:15:15.
Motion to approve. Support.
Any comments or not? Seeing none, all in favor? Aye.
Aye.
All opposed, same sign. Motion carries. This time we have public input. All those wanting to come before the committee, please rush the podium. Seeing none, we will move on to petitions and communications. Under item A, we have the health director. It's a memorandum of understanding with Midland, Saginaw, and Mid-Michigan District Health Departments. What's your pleasure?
So moved. Support.
We have a motion and support. Any discussion? Seeing none, all in favor?
Aye.
All opposed, same sign. Motion carries. Okay, item B, we have two items. We'll just take them together. We have personnel director vacancies for the sheriff department, a full-time CFO, 911 central dispatch, dispatcher full-time, and
Support.
okay. We have a motion and support for B1. Any discussion? Seeing none, all in favor?
Aye.
All opposed, same sign. Okay, under B2, we have part-time clerk typist vacancy for the personnel department.
Support.
We have a motion and support. Any discussion? Commissioner Krieger.
Thank you. Tim, so if I'm reading this right, we're gonna lose one of the part-timers and one's gonna become a full-timer?
Well, we have a vacancy, so we're not losing anybody in Sunday department in August. But yes, we'll be combining two part-time positions into one full-time.
And how are you gonna keep track of who's getting billed to what department?
We keep a log. We do that now.
Okay. All right, thank you.
Okay.
Any other comments, questions? Seeing none, all in favor?
Aye.
All opposed, same sign, motion carries. That brings us to referrals. I don't believe we have any. Any unfinished business? Any new business to come before the committee? Any miscellaneous? Yes.
Thank you, Mr. Chair. Just like to mention to everyone, make sure you get signed up for the New Bay Alerts. It's fantastic. I signed up and my gosh, you can put pictures of your pets, your dog on there and all that stuff and your cars and medical history. This is really an advanced program. This is really, Christian did a nice job with that. That's all I have. So all you people in the audience, get re-signed up. Thank you.
Chris, do you want to come forward and kind of let everybody know about that again? That they need to re-sign up because, you know.
Yeah, afternoon, Chris Sikorsky from 911. We launched the Baylor's program relaunch, really a reinvention on last Friday. And individuals that were in the system, the old system, we have their information, email, and phone number. And we send out messages to them. We're going to send out repeat messages to them, asking them to sign up. We'll continue to do that for the next 6 weeks. So those individuals that are in the system but will need additional information, as the commissioner alluded to. So we want residents to do is, if you have been signed up for Bay Alerts, to go to the website, go to the Bay County website, log into the Bay Alerts website, and re-sign up. There's a lot of additional information we'd like to gather from you to get you signed in. As you stated, it's a much better system. It's enhanced and a lot of bells and whistles to it. So we want residents to take advantage of that. So
And they can put in as much or as little information as they want.
That's correct. It could be as little as your email address, so we ask your email address as your handle, your username, and then whatever contact information you'd like to, whether it's a cell phone number, a landline telephone number, if you so choose. We did actually bring all our landlines in. We bought the landline information from AT&T. So we have every single landline in Dade County pre-programmed in, but you can add in information as well. Because this system is not duplicated. It removes duplicates. So if you add a phone number, it'll call you twice. But added information in, and then you can drill down. So if you're an individual with special needs, mobility issues, if you have pets, you can put information into the system, and then you can actually put photographs into the system. So it's really detailed. It's as little or as much data as you want to put in. The neat piece of the system is after we move to our new phone system that we're installing later next month, the next piece of the puzzle is we're investing in some software called Smart 911 that hooks together with the software, the Bay Alert software. So when an individual who signed up for Smart 911 and versus Bay Alerts, when they call 911, their phone number is hooked to that additional information. So that information will pop up on the dispatcher screen. So they'll see phone numbers, they'll see pictures of their loved ones, all that information being loaded up, we would be able to see. So it's important to log in to Bay Alerts, sign up. The future is that we're looking at after the phone system is add the Smart 911 feature as well. So looking forward to it. We're really excited about it and encourage residents to sign up.
Okay. Yes, Commissioner Regan.
There's a 4-digit code at the end that you have to put in to confirm it. I did it all except that 4-digit code. I didn't find a spot to put it in, but you have to confirm with that code that they text to you. So you make sure you do that step, but that's the final step to get you logged in.
Oh, okay. Any other commissioners?
Good job.
Thanks, Chris. Seeing none, we go to announcements.
Well, whether it's miscellaneous or announcements, what I'd like to do at this point is to bring to the attention of the residents of Bangor Township that on November 17th, plan on having a town hall meeting to talk about, I hate to use the word crime, but we certainly have things that are starting to escalate in the township. So what I'm hoping to do is at Bangor Township Hall at 6 o'clock on the 17th, individuals that have concerns of what's going on in the neighborhood, whether it be cars being rifled, break-ins, drug trafficking on the rail trail, people not really feeling comfortable to call the sheriff. I'm hoping to unite the private sector and the sheriff again. I'll be working with the Undersheriff Troy Cunningham. He'll be there that night, and we will probably look at putting together some type of a board that will oversee and have some way of measuring whether or not the revitalization of the neighborhood watch is indeed working. But we need to get a handle on what's going on in the township, and I think this is the first step to take control of the situation. So November 17th, it's a Tuesday at 6 o'clock,
At Bangor.
Bangor Township.
Okay, thank you. Commissioner Regan.
Yeah, I had a law enforcement official from the Northern County talk to me about the heroin problem. And I know Joel and them have been looking at it. They think we need to probably do more, get the word out, or whatever we need to do. Because it's becoming overdosing, a lot of calls, a lot of emergency room visits. So it's sort of an epidemic proportion. I talked to Joel a bit about it too, but whatever we can do to help law enforcement out or get the people educated, it's really a problem in the community.
Yeah, heroin's a big problem. Yes, Commissioner Kuhn.
Well, since we're talking on that, I think the big problem, I think we have to address what's going on, but this didn't happen overnight. It's been coming over a generation or so of people who have never had the opportunity to work in the middle class economy. They either are working 2 or 3 jobs, they see no hope, no future. So a lot of times people self-medicate to hide the problems, and we need to do a whole lot more mental health work with these folks, and or we need to recreate a middle class so people feel as though they have that they're going to be able to have a life
Right.
buy a home, have a family, support the fabric of society, the school system. That's not gonna happen overnight, but if you don't say anything, everybody seems to think everything's fine, but it's not. You look past the last 30 or 40 years, there's been no middle class, there's no jobs, there's service jobs. And we've evolved to that, and I think with that evolvement, you've seen people who wake up in the morning and they say, you know what, I don't have what my parents had, and there's a lot of problems. That creates a lot of mental issues, a lot of depression, and a lot of times people are going to find something to mask the pain. So ultimately, I think we need to stress for more mental health treatment, and can't just sit silent because we benefited from working in the middle class economy. The folks coming up behind us haven't. So if we just sit silent, we're just as guilty as though that created this service economy over the last 40 years. So hopefully, I think you start to talk about things, and hopefully some of the folks that can make the decisions at a lot higher, in a lot higher position than we are at, will listen. So if everybody was going to have something to say, I think that's where I'm coming from. You look at some of these people, and heroin's cheap, and I don't know if people are self-medicating or if they're, I can't see that as a recreational drug. I think they're self-medicating due to the fact that they're not very happy in their position.
Right. Commissioner Tilly.
Yeah, I sent Joel an email. I was in Iowa on vacation this summer. The Dubuque area had a major issue with heroin. I don't know if you read that article or not. And they haven't eliminated it, but they had, I don't know if I don't remember, I just pulled it up. I remember reading the article that they did something in that community, and they had a massive drop in use of heroin in a very short period of time. I don't know if something we can do or not. I have to go back and read the article.
There's a number of things that we're working on and that we're doing. It's not just law enforcement. The problem, as I explained before, we're less more people to drive the demand down. We are working with Mid-State Health Network, formerly Riverhaven, and one of the clinics in town to basically there's going to be a grant coming to one of the clinics in town, and they will purchase and distribute naloxone to first responders and a number of law enforcement agencies. And also it will disperse naloxone or provide naloxone to folks that are loved ones or even addicted to heroin, and providing them training on how to use that. Because a lot of times what happens is that I think it's in about 85% of the time that people overdose, they're with somebody. And when they overdose, then whoever they're with will usually hightail it out of there because they don't want to be subject to any kind of law enforcement procedures. But the other part of that is to get the education and understanding out to the general community, and that it's not just a problem that happens in inner cities or it's a problem that's happening everywhere, and that there are some things that we can do. One of the major targets for outreach we're going to have is to the medical community, which you might think, well, why would you want to do that? Well, to let them know that to look for the signs and symptoms of abuse, to work with their patients to try to get them treatment. Sometimes it takes 7 times to get through rehab to cure somebody. That's pretty common. But the other part of this too is to also provide the medical community too with some guidance of to use some of the tools at hand, like the MAP system, which allows a provider to look up and see everyone's prescription or all their patients' prescriptions. So if they're drug shopping, then that they will know right then and there, and then they can find an alternative to the pain and the treatment.
The other thing is that, and we haven't done this in schools in forever, to have some kind of a program at the school.
Absolutely.
And I know because of the academic rigor and stuff, we've eliminated all kinds of assemblies. We used to have lots of room for those, and we don't have any anymore. But that's another basis we can start with. And I was just reading the article that they did, they brought in some recovering addicts to do presentations on the effects of heroin to the students, so they can see what actually it does to a person. They can hear from the people what it actually does to them. And I remember when I was back in high school to have those things, and if it didn't do anything for a month or so, it scared the hell out of us. It did. And then sometimes people would go on afterwards to do something, but at least for a time period, it had an impact on us.
Well, one of the, I remember when I worked previously became a manager in the health department. I worked for the probate court on a comprehensive strategy project. And one of the things that was, that always struck with me, and it was researched and found statistically to be statistically significant, is that if parents and adults have clear expectations of their children, the children will usually follow in that. And so it's not just, we can't just expect parents or teachers to do this. It's everybody in the community. And you have to have clear expectations that, number one, it's not an appropriate pastime, I guess, or thing to do. But it's also, we have clear expectations that, as a community, that we're not going to, not only we're not going to tolerate this, but that we need to work on it together as a community and help those that are addicted, because it's a very, very hard struggle for these folks. And I don't mean to sugarcoat it or anything, but it's a struggle for your addicted.
Okay. Commissioner Krieger.
Yeah, Joe, if I'm not mistaken, I think there's a bill coming up in the House or the Senate that deals with just what you described, somebody overdosed and whoever was with them takes off because they were afraid that they're going to get hammered with being involved with drugs. And so what this does is it protects that person so that if something should happen, they can get a hold of 911 and hopefully get some medical help to the person who made a mistake.
Yeah, that's correct. The other thing too is that if you knowingly are with someone and then you don't respond to them, you're also negligent and liable as well. So that coming along and those types of things are very helpful. The other thing too with first responders, I know it's been a lot of talk, is that they wanted to know what their liability was legally. And actually, there is a law passed last year that excludes them from liability when they're trying to treat someone with naloxone or Narcan. So, we're trying to push that out as much as possible. But in as much as we want the first responders to have it, we want the loved ones to have it as well, because they're often the first ones that stumble upon victims of overdoses.
Thank you.
Joel, what would be the mechanism that they could use, the loved ones? Would they contact you guys over at the health department about that?
Well, when we get the finalization of the grant worked out with, their name escapes me, the treatment organization, but with Midstate as well, we'll put out a press release. They can, but in the interim too, they can seek a prescription from their own physician or their own provider, or if one of their providers is in the addiction treatment realm, they can get a prescription from them as well.
Okay.
Just what I think the calling for tattletale though is that the resistance against it is those that think everybody should be punished in the house because the drug's in the house, which doesn't solve anything. There's no common sense to that. Yes, they're all doing something wrong, but somebody's going to die as a result of 3 people doing something wrong or 2 people doing something wrong, and then now the other person's in trouble because they let this person die, ran out on them. Or if they don't ever get caught, they ran out and this person's dead, they could have saved somebody's life. So I hope they consider taking up that bill and passing it, because it's an absolutely necessity under the current situation that we have going on here in the state of Michigan. I'm good, thanks.
Commissioner Kuhn.
Thank you, sir. Well, this prescription is to help someone who goes into a overdose, right?
Called an opioid arrestor.
So what happens once they come out of that overdose? Do they get treatment? We probably got folks in our jails that are in there because they have a drug problem, are we providing them with, because, you know, if you give somebody something to come out of an overdose and you don't provide any treatment to them, they're just gonna go back in, you're giving them a prescription, that doesn't make a lot of sense. Unless we have a bigger plan to treat, instead of treating the symptom, treat the problem.
Correct.
So, just treating the symptom, you're not gonna really accomplish a whole lot without addressing the real problem. So where is the plan to treat the whole problem?
Well, the name of the provider that I was referring to is called Recovery Pathways. They're a treatment provider in Bay County here. There are a number of treatment providers for substance abuse in the Tri-County.
So anybody that needs treatment can get treatment?
We can try to get them.
We can try.
We can try.
All right. How do we get people treatment if, you know, if you can only...
That's where we work with community mental health, with Mid-State, with other providers.
Because if somebody is seeking treatment, they can't get in there, what does that accomplish? We would probably, I don't know how to do more,
Yeah.
but we need to be addressing it on the front end instead of bringing them out of coma and having
Sure.
to go back in without any treatment.
Now, I guess the best way to describe that is there is a minimum amount of recovery, and I don't know exactly, it all depends on person by person and their circumstances, but, you know, even if a person doesn't have health insurance or doesn't have the resources, there are some resources through community mental health and through Mid-State Network to provide treatment for folks. There are more if you have health insurance, and then, you know, if you're completely loaded, you can go to Malibu for.
But that doesn't happen.
But that's not happening for the overwhelming
So
majority.
if anybody watches this or the news isn't going to report on this, anybody that has a problem, they can, who do they contact to try to get some help?
I would have to contact Bay Area Behavioral Health.
Yeah, Baronet Behavioral Health.
Excuse me, Bay Area Behavioral Health. And I don't have the number in front of me, but we can get that for folks.
We should be putting it on the Bay 3 TV, flashing it on there.
And there's a website also that if you're a family member and you've got somebody that's has an addiction, that you can seek some help or at least talk to someone that can.
There's a
point you in the right
24/7
direction.
call line through Mid-State Health Agency that will talk a person through a crisis, that will get them set up with emergency treatment and interim and long-term treatment if possible.
But if we have a widespread problem, that's not getting out there. So we need to reach people, and hopefully if they need help, not help, but they can get help, not just talk about it and then need any help.
Part of that grant funding that will be coming from Mid-State to Recovery Pathways, a small part of it, and I'll be back here to talk about that, is some funds for outreach so that we can educate folks, like I said, on the particulars of addiction and opioid addiction, but also to provide them for those that treatment information as well.
Is there anything along that line that would work with the schools that Commissioner Tilley was talking about?
You know, part of those resources can be utilized, and we can probably get some school presentations, but what I would like to see, and I know I've talked to Commissioner Tilley about this and talked to the Sheriff's Department and others, is to get a robust program like they had in the 80s and the 90s. Talk about drugs in schools, or talk about drug prevention, and provide that education to students out there. There's basically got a whole generation from maybe late 90s through the current era that just, they get it in middle school and they might get a little bit in high school, but they don't get it like it used to be.
Right.
They don't get quite the amount of education and outreach.
Right. So is that something we can even put in for more grants or things like that?
Hopefully so, yes.
Okay. Commissioner Krieger, you had...
Yeah, and if I'm not mistaken, the courts went after a grant that's going to make a or allow an individual from probate court to stay with that individual that has an issue, so that instead of them being in a revolving door, coming in and not being sentenced properly or not getting the treatment, they will have an advocate that will stay with them and work them through the system. So that, you know, the courts are also a big part of this. Some of them don't need to go to jail, although there are some that I have to admit should be in jail, but the bulk of them are just like what Kim's saying. They need a helping hand to get a grip on what life's all about and have some opportunities or things to look forward to.
Yeah, they need treatment, and like I said before, it's like, sometimes it takes people 7 times to get your treatment to be fully recovered, and that's the frustrating part, but that's what we have to do.
Mr. Vergig.
We had the Barry Schmidt here before from the Prevention Network, and that's still out there. I think they've been working with the schools as far as I know. I don't know if that's a presentation in the past, so there is what they call Prevention Network.
I failed to mention that, you are correct. They do a pretty good job, but we'd like to see more out there as well.
Okay. Michael?
Thank you, Mr. Chair. At our community corrections meetings that we have every other month, of which the chairman and myself are members from the county, there are groups out there that seem to be led pretty much by the Bay Area Neck Behavioral Health, but there's other nonprofit agencies that also, they're there for the help, and they've got funding and grants, because we're always filling out for grants and receiving grants and stuff like that too. So I mean, I think we just need to educate and get this information out, as Commissioner Coonan said. So if somebody needs help, hey, here's who you call, or a loved one can call.
Yeah, it's not something to take lightly, you know. All of us that are out in the public, you know, see people that are down and out, like Commissioner Coonan was talking about, you know, they just don't have the hope for the future. And, you know, they try to medicate themselves, either it be alcohol or drugs. And we got a problem in both directions. It seems that right now, it's leading more into the heroin aspect and probably cocaine along that line too, so.
Well, this isn't, as I said before, in June and in July, but this isn't just a Bay County problem. It's happening all over the places. Commissioner Tilley pointed out some of the hardest hit communities around the East Coast, places where you would find them, New Hampshire, Vermont, Massachusetts. For some reason, those seem to be higher per capita heroin use. And it all comes down to a number of different things, but the price of heroin is cheap, and you've got folks that transition from painkillers onto that.
Right.
So it's something that, you know, as I stated before, it's not a law enforcement only problem. It's really a public health problem that we all have to work on together.
Okay.
One other announcement, Project Access is tomorrow at the Bay County Community Center, and that's a lot of service agencies, Salvation Army, whatever, will be there to help people. I'm not sure if there'll be any substance abuse counseling there, but it's an avenue for people to come in and find help in the community. It's from 10 to 2 at the community center.
Right. Anybody got anything else? Seeing none, move on to
Motion
adjournment.
to adjourn is always in order, Mr. Chairman.
Always is, and we are adjourned.